I welcome you on my channel Step 1 Insights. Let's start. A 45-year-old man is brought to the emergency department 30 minutes after the sudden onset of crushing chest pain. His father, maternal aunt, and paternal uncle all died of myocardial infarctions under the age of 50 years. Physical examination shows tendinous xanthomas on the hands and thickened Achilles tendons. Serum lipid studies show a total cholesterol concentration of 410 mg/dL, HDL-cholesterol concentration of 30 mg/dL, and triglyceride concentration of 140 mg/dL. The diagnosis of myocardial infarction is made. This patient most likely has a deficiency of which of the following? The patient described in the scenario presents with a history and symptoms highly indicative of familial hypercholesterolemia, particularly the sudden onset of crushing chest pain, consistent with myocardial infarction, a strong family history of early myocardial infarctions, tendinous xanthomas, and significantly elevated total cholesterol levels. The most likely cause of these symptoms and findings in the context of familial hypercholesterolemia is LDL receptor deficiency. Here's a breakdown of the options. A. ApoB48. This apolipoprotein is involved in the assembly and secretion of chylomicrons in the intestine, and its deficiency doesn't typically present with the symptoms described in this scenario. B. ApoC. While important in lipid metabolism, deficiencies in ApoC are not typically associated with the clinical presentation of familial hypercholesterolemia and early-onset myocardial infarction. C. HMG-CoA reductase activity. This enzyme is involved in cholesterol synthesis. Statins, which are used to treat high cholesterol, inhibit this enzyme. Deficiency of HMG-CoA reductase would not cause hypercholesterolemia, but rather would decrease cholesterol synthesis. D. LDL receptor. This is the most likely answer. Familial hypercholesterolemia is most often caused by mutations in the gene encoding the LDL receptor, leading to elevated levels of low-density lipoprotein, LDL cholesterol in the blood, which is the primary issue in this patient. E. Lipoprotein lipase activity. This enzyme is crucial in the breakdown of triglycerides from chylomicrons and very low-density lipoproteins, VLDL. Deficiency would lead to elevated triglyceride levels, but the patient's triglyceride levels are not significantly elevated. Considering the patient's symptoms, family history, and lab findings, the most likely diagnosis is familial hypercholesterolemia due to a deficiency of LDL receptors. Thank you for watching this video. Subscribe my channel, click like, and never give up.